costs. We focus a lot on expanding insurance, but expanding insurance is not expanding access. There are people today in America who have insurance, but they don't have access. And the fact is that we have 60 million people who do not have access to a physician on a regular basis. And many of those people, according to recent studies, 45,000 may die because they don't get to a doctor in a timely manner, and by the time they walk into the doctor's office, their situation is terminable. So we need substantially improved access to health care. And when we improve access, we save money because people do not go to the emergency room. They do not end up in the hospital sicker than they otherwise would have been. Mr. President, we need a revolution in primary health care in America. Unless we do something and do it now, our primary health care system infrastructure is close to collapse. We have an aging primary care workforce which is not being replaced. At a Senate hearing I chaired earlier this year, it was noted that only 2% of internal medicine residents were choosing primary care as their specialty. Happily, Mr. President, there are two federal programs that can both assure access and control costs. And I refer to the Community Health Center program and the National Health Service Corps. Both are well-established programs that have garnered broad bipartisan support because of their proven cost effectiveness. What a federally qualified community health center is about, and I believe they exist in all states in this country. They have widespread support from members of the Senate and the House, both political parties. What they are about is saying that anyone in an underserved area can walk into that facility, get health care, either through Medicaid, Medicare, private insurance, or a sliding scale. If you don't have enough money, you pay on a sliding scale basis. Low-cost prescription drugs. This is a very, very successful program that now provides health care to over 20 million Americans, and it is a 40-year-old program, again, supported widely in the House and the Senate. Mr. President, I am pleased that in the Senate bill, the Senate bill recognizes the importance of both federally qualified community health centers and the National Health Service Corps. The National Health Service Corps is a long-established federal program which says to people in medical school, we are prepared to provide debt forgiveness to you. And on average, I know in Vermont, people are coming out $150,000 in debt if you are prepared to work in primary health care in an underserved area. In the Senate bill, we recognize the importance of the federally qualified community health center and the National Health Service Corps. And in fact, our bill calls for authorization levels that, if appropriated, would enable the health center program to expand to every underserved area within 5 years and would result in supporting at least 40,000 more primary care professionals in the next 10 years, doctors, nurses, dentists. But we can and must improve the Senate bill. I favor very strongly the language in the House bill which calls for a dedicated trust fund with mandatory annual spending for health centers and the National Health Service Corps. In other words, in the Senate, we have authorized funding. The House has established a trust fund to actually pay for it. The Senate bill contains authorization levels that would be sufficient to fund a community health center in every underserved area in America, and thus provide primary health care to 60 million more people by the year 2015. These are people who do not have to go into the emergency room. They don't have to go into the hospital because they're sicker than they should have been. They're going to get timely, cost-effective health care at a community health center. Therefore, let me be very, very clear. I favor the language in the House bill, which includes community health centers in its public health investment fund and guarantees mandatory funding for health centers totaling $12 billion over the next 5 years. This is in addition to the $2.2 billion current annual appropriation for community health centers, which it is anticipated would also continue to be appropriated each of the next 5 years. While this House funding level will not achieve a health center in every underserved area, it will take us very far toward that goal, bringing primary health care services to some 40 million citizens living in underserved areas. And also in the House bill, there is appropriated money to greatly expand the National Health Service Corps. So, in the middle of all of this discussion on health care and health insurance, let us not forget a few basic points. 60 million Americans do not have access to a doctor. We need a revolution in primary health care. We need to make sure that we have the physicians, the nurses, and the dentists who are going to get out in underserved areas. Senate bill provides authorization. The House bill provides a trust fund for community health centers and for disease prevention in general. And my strong, strong hope, and I'm going to do everything I can to make sure that it happens, is that the Senate adopts the House provisions. So, Mr. President, if we are serious about providing health care to all Americans, we've got to expand community health centers, got to make sure there are primary health care doctors, dentists, nurses out there. In addition, we need to focus on disease prevention, and I know my colleague from Iowa has worked very, very hard on that. So we've got to support the trust fund in that area. I would yield to my friend from Iowa.
First, I want to thank the senator from Vermont. There's no one who has been leading the charge longer and stronger and more fervently for our community health centers than the senator from Vermont, Senator Sanders. I just want to thank him for that. You know, obviously, we all have community health centers in our states. In Iowa, they've been a godsend for so many people in rural areas that did not have access to these kind of facilities. I remember one time I was in Fort Dodge several years ago, and they had a small free clinic there. It was in a church basement one night a week for people who could come in that didn't have insurance, couldn't get access to a doctor. They had one old dental chair there. I think every couple of weeks a dentist would come in for people. A woman had come in and had tried, she had an abscessed tooth that was hurting her so much she took a hammer and a screwdriver and tried to knock her tooth out. Of course, then she damaged her gums. That's how desperate people get. Well, it was because of that, I got the Fort Dodge community looking at a community health center. They now have a wonderful community health center. They have doctors there, they have nurses there, and people have access to that kind of dental care and health care.
Let me just mention to my friend, in the state of Vermont, the poorest region of our state borders on Canada. It's called the Northeast Kingdom, the northeastern part of the state. For 30 years, we have had a number of community health centers in that region. And you know what? Amidst all of the poverty, all of the unemployment, all of the economic problems, we do not have a problem in terms of primary health care in the poorest area of the state of Vermont, precisely because of these community health centers, which you indicate addresses dental care, which we often forget about, mental health counseling we forget about, low-cost prescription drugs. So I look forward to working with the chairman of the Health Committee and others to make sure that we fund the kind of revolution we need in disease prevention, in primary health care, which at the end of the day improves people's health, keeps them out of the emergency room, keeps them out of the hospital, saves us money. Study after study saves us money.
I can't help, I thank the senator again, I can't help, but every time we talk about community health centers, I always have to add one thing. A lot of people think community health centers are just for poor people who don't have anything. Nothing could be further from the truth. They will take anyone who walks in the door. You can have health insurance, you can be on Medicare, you can be on Medicaid, you can have no insurance, you can have a great insurance plan, whoever walks in the door. And they have a sliding scale based on income, based on resources of who they will take. It's been my experience, I'd ask the senator from Vermont what it's been in his area, but it's been my experience in our growing number of community health centers in my state of Iowa, that more and more people...
Consent for 2 minutes more.
Without objection.
with insurance are coming to community health centers. Why? Because they get the kind of hands-on care, they get the kind of supportive services, a lot of times language barriers that are a problem. They get preventative care. They get all the things that make people feel better about their own quality of health care. So more and more we're finding people that actually have health insurance going to community health centers. I ask if that's been the experience.
Let me concur with my friend from Iowa. In the state of Vermont, we have gone from 2 to 8 with 40 satellites. Over 100,000 people in Vermont are now accessing community health centers for their primary health care. And the other point that we don't often make about community health centers, they're democratically run. They're run by the communities themselves. And my experience is exactly what the senator from Iowa's experience is. They are community health centers. In rural areas, it's not rich or poor. By and large, most of the people, regardless of income, go in there. The doctors are there for a long time. The dentists are there. It is, in fact, in the best sense of the word, a community health center, open and accessed by all people. People take responsibility for it because it's democratically run. It is a program. It is one of the bright, shining stars of public health in America. And I would hope to work with the chairman of the Health Committee to make sure that these programs are funded adequately in this bill, that we adopt the language in the House, which goes a long way. I would yield to my friend.
I can assure